Hello guys, how are you? Welcome to our channel, Last Minute Pharma, your exam antidote. Today we are here with lecture number 6. Okay, so till now we have covered 5 lectures in the general pharmacology series and we have completely understood about the pharmacokinetic aspect. Now when I talk about the pharmacokinetic aspect, it means nothing but the ADME properties, that is absorption, distribution, metabolism, excretion. Okay, now we are going to learn about the pharmacodynamics. So in short, if you have to understand what is pharmacodynamics, pharmacodynamics mean what the drug molecule is going to do to the body. So now we understood that pharmacokinetics was what? It was nothing but what the body was going to do to the drug. Like body is going to absorb the drug, body is going to metabolize the drug, body is going to distribute, body is going to excrete. But now we are going to understand that what is the drug going to do to the body. So now in this aspect, you mainly have to focus on the mechanism of action. So how the drug molecule is going to show its therapeutic activity, it means it can be either receptor mediated or non-receptor mediated. Then later you have to understand, once the mechanism of action is seen, then what are the various changes in the normal physiology? That means what are the pharmacological action of the drug? What are the pharmacological action of the drug? Now after studying pharmacological action, you are supposed to understand about the adverse drug reactions. So what are adverse drug reactions? Adverse drug reactions is nothing but the unintended reactions, okay, that usually that medicine should not be doing, but if it is doing unintended, any unintended effect that the drug is going to give is called as your adverse drug reaction. Okay, now when we are talking, like before going in detail about the mechanism of action, pharmacological action, and then about areas, we have to understand about the drug action. What are the various drug actions? Okay, so mainly in that we are having your first is your stimulation. So what does stimulation mean? Stimulation means you're going to activate a particular organ or a system, right? Then exactly opposite is your depression. That means you're going to reduce the activity. That means you're going to reduce the activity of the particular symbol. Okay, now main thing is irritation. When the drug is there and it's going inside the body, okay, especially if you talk about the topical applicants, okay, there's something called as counter irritant. You will have studied in your first year civics, right, about counter irritant. So when you're going to apply certain drugs on topical administration, they can irritate you. So especially for the drugs, you know, which we are going to give for the deep intended pain. Okay, when there's a deep pain, like when there's a sprain, we are going to apply some drug which can cause irritation to your skin. For example, you're having methyl salicylate, right? Now, or eucalyptus oil you can talk about. Now, next is your cytotoxic cell. Next is your cytotoxic cell, cytotoxic effect. Okay, what does cytotoxic effect mean? Cytotoxic, that means it is toxic to the cell. Now, which kind of cell? For example, if the bacterial infection has happened, bacteria is a cell. So when you are going to take antibiotics, what is this antibiotics going to do? These antibiotics are going to kill the bacterial cell. Yes or no? That is what is called as this antibiotics you talk about or anti-cancer you talk about. They are going to act against that particular cell. That's why we are calling it as cytotoxic cell. Now, cytotoxic effect. Now, what is replacement meaning? For example, if you talk about your thyroxine, you talk about your in the diabetes case, you talk about insulin. These drugs which are there, you are replacing the natural hormones, okay, or you are replacing the natural secretions. And why are you doing it? For example, you are in diabetes mellitus. What is the condition over there? That insulin secretion is being interfered, right, or the insulin secretion has been decreased. That's why we are replacing it by giving it insulin drug. Okay, I hope you understood. We just try to understand with the example. If you talk about your stimulation, then one of the major thing about stimulation you have to understand is about your adrenaline. What is this adrenaline going to do? Adrenaline which is there, it is going to stimulate your cardiovascular system. So in cardiovascular system means what is there? Mainly you're going to have it's going to cause your vasoconstriction. This is going to cause your vasoconstriction. Then later if we talk about the same adrenaline is going to increase the force of contraction of the heart. the adrenaline which is there, it is going to increase the force of adrenaline, force of contraction. Now, how is it doing? What are the different types of receptor? We'll be studying that in the upcoming lecture. Then later, if you talk about your depression, so depression means what? You're going to decrease the activity of a particular organ or a system. Here, what are we doing? We are going to decrease the activity, right? Yes or no? Sorry, here in stimulation, we are going to increase the activity. For example, we are causing vasoconstriction, we are increasing the force of contraction, but there are some drugs which will cause depression. For example, you talk about your local anesthesia. If you talk about your local anesthesia, what are these local anesthetic drugs are going to do? They are going to suppress the central nervous system. They are going to suppress the central nervous system. I hope it is clear. This stimulation and depression is exactly opposite of each other. Now we have to understand about the irritation. As I told you, some drugs when you are going to apply on the skin as a topical application, like for deep-seated pain, okay, that's why that property of the drug is called this counter-irritant effect. So what does counter-irritant effect mean? It's going to cause irritation and then going to cause you relief. That's why it's called as counter-irritant. One of such example of such drugs is your methyl salicylate. It is your methyl salicylate. So these are one of the topical drugs which are using it for getting treated from deep pains like sprain or ankle sprains, all this thing is there, right? So for that we are going to have this methyl salicylate. Then what is cytotoxic? I told you cytotoxics mainly are going to have your antibiotics. You're mainly going to have your antibiotics. Then the other one you are going to have your you are having your antibiotics as main one, and then anti-cancer. Then you are going to have your anti-cancer. So what is this drug? What is this action? Cytotoxic. It is going to be toxic to the cell. For example, a bacterial infection is there. So this drug is going to go and kill the bacteria. That's why it's called a bactericidal effect. Right? So these one of the drugs or the class of the drugs we are going to have, they are coming under your antibiotics. And then the similar class which is there, it is called as your anti-cancer. Anti-cancer means these drugs which are there, they are cytotoxic to the cancerous cell. I hope you understood the meaning of cytotoxic. Now, the other one which is there is the replacement. For example, when you are having a deficiency of certain hormones, like in case of your hypothyroidism we talk about, or diabetes you talk about. So what is going to happen over there? There's going to be less secretion of insulin, less secretion of thyroxine, right? So in this replacement therapy, mainly you can use your, what are the drugs which are there? That is coming here, insulin, and then you are going to have your thyroxine. See, many other drugs are there having this particular action, but I just wanted you to understand that what are the various drug actions you are going to have: stimulation, depression, irritation, cytotoxic, and replacement. And these are the examples. I hope you got it. Now, next we are going to talk about the different mechanism of action. Like what are different mechanism of action of the drugs? Like it can be either receptor mediated or non-receptor mediated. So let's try to understand that a bit more in detail. Now we are going to understand about the mechanism of action, okay? So when the drug is going to enter inside the body, if it is going to bind to a particular receptor, then going to show the pharmacological action, that category will be under the receptor mediated, okay? And if the drug is showing the action without attaching or without getting binded to a receptor, then that will be coming under the non-receptor mediated type of mechanism of action. Now, in the non-receptor mediated mechanism, you are mainly having by physical action, then you are having by chemical action, then through enzymes, then through ion channels, through antibody formation, and then the transporter. One by one, we'll understand and we'll learn. Okay. Now here we have to understand by the physical action. So the drug which is there, what is going to happen? It is physically going to show action. For example, if your osmosis, for example, is your osmosis. Certain drugs are there. For example, if we talk about 20% mannitol, okay, 20% mannitol which is there, this drug is mainly used for the case of cerebral edema. Whenever there is a fluid accumulation, to maintain the osmosis, you are going to have this drug which is there, this 20% mannitol, which is having its action or which is going to show its pharmacological action by the help of physical action, that is your osmosis. Then is your adsorption. See, not absorption I'm talking about adsorption. So what does adsorption mean? In case of metal toxicities, or in case of not only metals actually, in case of any toxin, if any, for example, snake poison we talk about, or any toxin which is there, it has entered the body, then we use this charcoal, right? Universal, say universal savior. Yes or no? So whenever there's a toxicity of a particular, we are mainly going to use charcoal. And this charcoal which is there is going to absorb the toxin and then going to be excreted. Okay, I hope it is clear. By the process of absorption, you are going to have your charcoal activity. Then later is your demolition. Now what does demolition mean? Demolition means a soothing effect. Demolition means a soothing effect. So when do you get a soothing effect? Whenever you take cough syrups, right? So whenever if you talk about cough syrups, if I talk about your cough syrups, this will come under the ideal have its pharmacological action. For example, whenever there's an inflamed mucosa, yes or no? So this one is going to provide a soothing effect. This one which is there, okay? This drug which is there, cough syrup which is there, it's going to provide a soothing effect, and that action, that physical action is called as your demolition. I hope you are understanding that when the drug is going to show action, one of the type is non-receptor mediated. In non-receptor mediated, I'm talking the drug which is going to act by physical absorption, physical action. In that you are having your osmosis, then I talked about adsorption, then I talked about demolition. Last but not the least is your radioactivity. So radioactivity, especially we are going to use this, one of the example is iodine 131. Where are we going to use this iodine 131? This drug which is there, or this radioactive drug which is there, we are going to use in the case of hyperthyroidism. What is hyperthyroidism? When the thyroid gland is going to excessively secrete thyroxine hormone. So what we will do? We are going to destroy the thyroid tissues. We are going to destroy the thyroid tissue. So for that we are going to use the I-131, which is going to help us in the selective destruction of the thyroid tissue. Now how it happens, all these things we'll be learning in the upcoming lecture. But are you understanding that this is not having any receptor mechanism? This is by showing its physical action. This is your osmosis, adsorption, demolition, and your radioactivity. Now we are going to see how the drug is going to show its action by chemical mediation, or by chemically, how the drug is going to act chemically. Now for that one example which is there, we are going to use, okay, one example you can discuss. If we talk about by chemical, just right over here, okay. So by chemical action, if you see, that is your antacids. What are antacids? Antacids is nothing but these are weak bases. Antacids is nothing but weak bases. Okay. So for like sodium bicarbonate, you talk about, yes, no. When you talk about milk of magnesia, so what, like magnesium hydroxide, what is all these things? These are going to be a weak bases, or your antacids. What are they going to do? They are going to neutralize the excess acid from the gastric or from the stomach. That is their antacid. So by chemical mediation, okay, by intake of a chemical, you are going to have it. It's a chemical reaction, right? The acid is going to react with the base and it's going to neutralize. So how is the drug showing the action? By the chemical action. I hope it is clear. Okay. Now, one more example which is there of a drug, that is your dimercaprol. What is this drug dimercaprol? This drug which is there, this is used in the case of your arsenic poisoning. This drug which is there is used in the case of arsenic poisoning. Now how is it? I'll tell you, okay. This dimercaprol which is there, this is going to act as a chelating agent, okay. Whenever there is a metal toxicity, we give some chelating agent like a dimercaprol, and this dimercaprol is going to bind to this metal, right? That's what is chelating agent, yes or no? And then this is going to get converted to water soluble complex. This is going to get converted to water soluble complex, and as it is water soluble complex, this can be easily excreted, and hence the metal toxicity can be decreased. Hence the metal toxicity can be decreased. So we are using this chelating agent. Again, a chemical reaction, yes or no? What is happening? Chelating complex you are going to add, and the metal is going to bind to the different chelate, like this metal is going to bind to the chelating agent, and then that will get converted to water soluble and will be easily excreted. So these are two examples which you have to understand for your by chemical action. Now, next we are going to discuss about through enzymes. Okay, there are some particular enzymes which I can give you example. Okay, that is your ACE enzyme. Where is this ACE enzyme present? What is ACE? Angiotensinogen converting enzyme. It's nothing but angiotensin converting enzyme. So what is the main function of this angiotensin convert? Okay, first of all you should understand that this ACE enzyme is present in the, many people will get confused over here. This is going to be present in the lungs. This is going to be present in the lungs. ACE enzyme which is there, this is present in the lungs. So what is the role of this angiotensin? What is the role of this ACE? This angiotensin is responsible for converting your angiotensin 1 to angiotensin 2. This one which is there ACE, this is responsible for converting your angiotensin 1 to your angiotensin 2. But now, what is the problem with this? This angiotensin 2 which is there, right? This is a vasoconstrictor. This is a vasoconstrictor and this can cause hypertension. This can cause hypertension. So for the patient, okay, so what is going to happen over here? There's an enzyme that is ACE and this is going to convert your angiotensin 1 to your angiotensin 2, and this angiotensin 2 is going to cause vasoconstriction which can lead to hypertension. That's why you are having an antihypertensive drug, that is your ACE inhibitor. Okay, so this drug which is there now, the drugs which are there, these drugs are going to show its action by blocking this enzyme. We are going to block this enzyme. If you block the enzyme, we can decrease the synthesis of angiotensin 2 rate. So if you are decreasing the synthesis of angiotensin 2, then vasoconstriction can be decreased and it can act as an antihypertensive. One of the very famous antihypertensive drug, if you block this, it is called as ACEI. That's nothing but angiotensin converting enzyme inhibitor. And one of the example you are having captopril. Don't worry, we'll be discussing in detail about these drugs in the upcoming lectures. Okay, I hope it's clear till here. Now, one more enzyme where you have to understand. This is one enzyme I told you, that is angiotensin E. Okay, angiotensin converting enzyme. Now, I will tell you about one more enzyme, that is xanthine oxidase. So let's try to understand what is happening over here. You are having xanthine. Then with the help of your xanthine oxidase, this is going to get converted to your hypoxanthine. Okay. This is going to get converted to a hypoxanthine, and then again with the xanthine oxidase enzyme, it's something called oxidation reaction. Okay, so xanthine with the help of xanthine oxidase is going to get converted to hypoxanthine, and then this hypoxanthine is going to get converted to uric acid. And accumulation of uric acid, this is going to lead to gout. This is going to lead to the gout. So we have the drugs which are going to block this xanthine oxidase inhibitor. We have the drugs which are going to selectively block this xanthine oxidase drug. Enzyme. So again, this drug which is there, it is showing the action. See, we are understanding the non-receptor mechanism. So this drug is going to show the action through the enzymes. This drug which is there is going to show the action through the enzyme. So what is going to happen if you block the xanthine oxidase? If you block xanthine oxidase, there will not be uric acid. So that's why it will be used as an anti-gout medication. An example of such drug is your allopurinol. This allopurinol is going to inhibit the xanthine oxidase, and if you inhibit the xanthine oxidase, then you are going to decrease the synthesis of the uric acid, which will lead to the anti-gout action. Okay, I hope it is clear. This was about through enzymes. Now let's try to understand through ion channels. What about through ion channels? Like for example, for neuronal mechanism, I hope you have understood about sodium channels are there, potassium channels are there. Yes. So now these drugs which are there is local anesthetic drugs. Okay, there are some examples of local, like for example, we talk about lignocaine. Okay, so all these things, local anesthetics which are there, they are going to block the sodium channel. Okay, this ion channel means some drugs are there, like your local anesthesia. Okay, like a local anesthesia, these are going to block the sodium channels. These are going to block the sodium channels. So if sodium channel is blocked, then what will happen? Polarization won't happen. Neuronal mechanism will be stopped. So then what will happen? Nervous system will be, if there is no neural transmission, obviously you will have the anesthetic effect. I hope it is clear over here. Through ion channels, you are having a local anesthetic which is going to block the sodium channels. Okay, this is nothing but through the ion channels. Now next is here through antibody formation. Generally all your vaccines which are there, okay, generally all your vaccines which are there, they are mainly going to come under the category of your through antibody formation. That is your vaccines. Like maybe you talk about your BCG vaccine is there. Yes or no? Like for example, like BCG, that's your tuberculosis and oral polio. All these vaccines are what? These are like the inactivated antigens, right? So when you're taking these vaccines, then what is going to happen? See, this is a drug. Vaccine also is a drug. So when you're going to take inside the drug, this drug is going to show the action. How? By producing the antibody. I hope it is clear. Now, the last one which is there, that is because of transporters. Okay, let's try to understand this transporter mechanism clearly. For example, you are having your antidepressant drugs. Okay, some antidepressant drugs which are there, that is your SSRI. You will not understand now, but I'll just try to explain you in detail. Okay, very short in crisp way. SSRI is nothing but your selective serotonin reuptake inhibitor. Okay, selective serotonin reuptake inhibitor. So what is going to happen over here? So you're having your serotonergic neurons over here, okay, and then what is going to happen? These drugs which are there, okay, these drugs which are there, SSRIs which are there, they are going to block, okay, they are going to block the 5-hydroxytryptamine, that's nothing but serotonin transporters. These are selectively going to block the 5-hydroxytryptamine transporters. Imagine there's a transporter over here and you are having your 5-hydroxytryptamine, that's nothing but just serotonin. Okay, 5-hydroxytryptamine means just serotonin. So now, when this serotonin will not be able to be not taken by the, or will not be able to reuptake, will not be able to taken by the your transporters, because your SSRI which is there is going to inhibit this transporter. So how is this drug showing the action now? By blocking the transporter. See, don't try to understand the MOA now. You just have to understand the different drug action. How is the drug action going to be seen? Now here we have to understand that, mainly what you have to understand, that this drug is going to show the action by blocking this transporter. That is nothing but your which transporter? 5-hydroxytryptamine transporter. So I hope it is clear that you have to understand that all these methods which are there, which we have just discussed, is coming under the non-receptor mechanism. And now we'll be discussing about, see, this is very important, okay. Now we'll be discussing about the different receptor mechanism, and in that 100% question you will have about what are different types of receptor families, what are different types of receptor and drug interactions, like your agonist, antagonist, inverse agonist, partial agonist. We'll be discussing that in detail now, okay. So now we have to understand about the receptor mechanism of a drug. Okay, so now we are going to discuss about the receptor mediated mechanism of action. Okay, so now initially we understood, like in the non-receptor mediated, that the drug which is there will not bind to receptor, but there are different means that drug can have an action, like physical method were there, through blocking certain enzymes it was there, vaccines were there, yes or no. But now we are going to discuss, see, your body are having various types of receptor. Okay, see, there is a topic called receptor family, a very important one, like ion channel family is there, and G coupled receptor, one of the 100% question which is going to be there. Okay, so now we are going to understand about the receptor mediated mechanism of action. Okay, so now what is going to happen in receptor mediated? The drug molecule which is there is going to bind to the receptor. Okay, so this is Valentine week special. Okay, so like your drug is a male, receptor is a female, they are going to bind together. It's nothing but the drug receptor complex, and once this drug receptor complex which is there, then the drug which is there is going to show an response. Okay, try to understand over here. Drug which is there is going to bind to the receptor, then in that it's going to see, this is a reversible stage. This is a reversible stage, but once the complex has been formed, once the drug receptor complex has been formed, and then this drug receptor complex is going to show certain pharmacological action. I hope it is clear. But now, one very important thing you have to understand over here, okay, before going to this agonist, antagonist, partial agonist, two things you have to understand. Okay, what is the meaning of affinity? Okay, what is the meaning of affinity, and what is the meaning of intrinsic activity? Okay, so affinity means, okay, if I talk about affinity, is nothing but the ability of a drug, to bind to the receptor. It's the ability of a drug to bind to a receptor. That is the meaning of affinity. That's the meaning of affinity. Affinity means liking each other. How much the drug is liking to bind to the receptor is what you will learn, or what that is what it means. That's your affinity. Then what does the intrinsic activity mean? What is the intrinsic activity? That when the drug is going to be, affinity is okay, fine, the drug is binding to the receptor, but is it capable of showing the pharmacological action? That is nothing but the intrinsic activity. So intrinsic activity means the ability of the drug to show the pharmacological action. This means it's the ability of a drug to show the pharmacological action. Okay, if you understood this complex of your affinity and your intrinsic activity, then all this 4 will be very easy. Okay, so now we are going to understand about what are the different receptor mediated mechanisms of action. In that you are going to have your agonist, then you are going to have your antagonist, then partial agonist, and then your inverse agonist. And with this, there are certain examples of the drug which are going to show this type of mechanism or this type of receptor mediated. See, again I'm telling you, don't go and run behind mugging up the examples. Okay, initially first time you are seeing these examples, so it might be something new, you might face difficulty learning it, but once you complete your whole pharmacology second year pharm.D or whatever, whenever you are learning this pharmacology, when you complete your pharmacology section, then you will understand this better, and you don't need to remember the examples also, because it will be so common, that you don't need to remember, it will be fit in your brains. Okay, so now we'll understand about what is the meaning of agonist. Okay, so agonist means what? These drugs which are there, okay, these drugs which are there, they are going to have high affinity. So what is the affinity? These drugs are going to have an ability or high binding capacity with the receptor. So this drug is going to bind to the receptor. Okay, but the problem over here is, or no, not the problem, but if we talk about the intrinsic activity, this is going to have a high intrinsic activity. So these drugs which are there, they are going to bind to the receptor. That means they're having the affinity, and then they're going to show the desired response or desired pharmacological action. That is why we say they're going to have the high intrinsic activity. Similarly, if we talk about exact opposite, that is an antagonist. What is the problem with antagonist? Antagonist which is there, yes, it is going to have a higher affinity. If we talk about antagonist, it is going to have higher affinity, but the intrinsic activity which is there, it is going to have no intrinsic activity. Okay, these drugs which are there, they are going to have no intrinsic activity. So what is this drug going to do? These drugs are going to bind to the receptors. Please note, these drugs will go and bind to the receptor, but will not be able to show any of the pharmacological activity or the intrinsic activity. This type of drugs are called as antagonist drugs. These are called as antagonist drugs. Now, for example, you are having an atropine, that's nothing but your muscarinic blocker. Like these are going to bind again. See, new terms, muscarinic, cholinergic, all these things we will be studying in drugs acting on central nervous system. Drugs acting on central and your autonomic nervous system. Mainly autonomic nervous system, we will be studying about your muscarinic receptor. But what you remember over here, antagonism means they are going to have the binding capacity to the particular receptor, but the intrinsic activity which is there, it is not shown. The pharmacological action is not shown. Okay. Now, if we talk about the partial agonist, okay, what does partial agonist mean? Partial agonist means not like it's not going to have like so much affinity, but yeah, okay, up to a certain level, yes, it is going to have affinity. Okay. And even the intrinsic action which is there, it is not as much as, so it's not completely agonist. See, agonist means what? It is having high affinity and high intrinsic activity, right? But this partial agonist will be having certain amount of affinity, and then again little bit less compared to agonist, but yes, some amount of intrinsic activity will also be seen. For example, is your pendolol. Okay, please check the examples. This is morphine, this is for your atropine, and this example is for your pendolol. So pendolol means what? These drugs are going to bind to the receptor, but the intrinsic activity is not as much as the agonist, but yeah, comparatively less. That's why I'm telling it. It is not the antagonist, because antagonist means what? No intrinsic activity. Okay, but here, yes, there is certain amount of intrinsic activity. So it's neither a complete antagonist nor a complete agonist. That's why I'm telling you, this drug will come under the category of your partial agonist. Okay. Last but not the least, very interesting one, that is your inverse agonist. Okay. These are very naughty people. Okay. So what is the problem with these? These drugs which are there, they will have affinity. Okay, they are having the capacity, or they are having the capacity to bind the drug, to the receptor. These drugs are going to have the capacity to bind to the receptor, but the intrinsic activity which is there will be exactly opposite of the agonist. Okay, this intrinsic activity will be exactly opposite to that of agonist. Now let me explain. This one I'm pretty sure majority of you wouldn't have understood. Now let me explain with you an example. Okay, So this benzodiazepine which is there will go and bind with the benzodiazepine receptors, okay, and then will be producing your anti-anxiety or antidepressant effect. Okay, what is that? That is nothing but a agonist activity. No, benzodiazepine going to bind with receptor and then intrinsic activity is seen. That's nothing but anti-anxiety or antidepressant. But now your beta carbolin drugs which are there, they will be binding to benzodiazepine receptors. Okay, they will be going to bind to the benzodiazepine receptors, but the activity which is there, it is exactly opposite. Instead of producing antidepressant and anti-anxiety, these beta carbolin drugs, notorious ones, these are going to cause your depression and your anxiety. Okay, I hope it is clear. So instead of producing an antidepressant effect, these drugs are known for producing the depressant effect. Okay, so in this one, okay, you don't have to go and run with the examples, just try to understand with the aspect of your affinity and intrinsic activity. Okay, so this is all for today's video. We are going to discuss, okay, we have discussed about the different types of receptor mediated complex, receptor mediated mechanism of action. Then we discussed about the, what else we have discussed, the non-receptor mediated by chemical action, yes or no, by physical action. Okay, this is for the video. Hope you enjoyed it and have fun. Please like, share and subscribe, and in the further upcoming one we'll be discussing a very important topic, that is about the receptor family, where we'll be discussing about ligand gated, then we'll be discussing about nuclear receptor, then you're having your very important 100% 5-marker question for RJHS exam, that is your G coupled protein receptor. Okay, very important. Signing off for today. Thank you everyone. Please like, share, subscribe. Notes are available in Telegram channel. Do avail it. Thank you.